afternoon, everyone. Welcome. My name is Irem Radzik, Senior Director of Product Marketing at Reltio, and I'm very excited to have Chad Lindsay, Vice President of Enterprise Systems and Data and Analytics from Clario, here with us today. We will talk with him about how they reshaped their very messy data architecture and created amazing efficiencies for their internal stakeholders, as well as how they support clinical trial services for life sciences companies. So thank you so much for being here with us. Welcome. Great to have you. So Chad, maybe we should start with first learning about a little bit about Clario and your role at Clario.
Right. So unless you're in the clinical trial space, you probably don't know Clario, but that's what we do. We are data endpoint collectors for clinical trials. So we've got products out there and they collect spirometer data and how you're feeling before you took the pill and after, and all of that data comes in, we process it, and we push it back out to the pharmaceutical company so they can decide the effectiveness of the drugs that they're testing. But we do have 4 major divisions. You've probably can read those and figure them all out except for maybe eCOA. And I've referenced eCOA a lot, so I want to tell you what that is you've got your tablet or your phone, and you record, how did you feel 2 hours after you took the pill? I felt 1 to 5. What's your pain level between 1 and 10? So that is eCOA. It's really a survey tool that records that, so the old ways of writing it on paper. My role is, I've got enterprise systems, data analytics, which is actually 2 different tracks, because we have our platform that we push out to our customers, our products that we sell, and then we've got the internal, finance, sales, what they need. And then I also have a newly formed group called Internal App Dev. So I wear different hats depending on the time of day.
Internal stakeholders as well as how you service the end users. So when you started at Clario, tell us about the data architecture and any challenges around that.
Yeah, I guess the best way to explain Clario is we are a company of companies. 2 large processors came together and formed Clario. Both of those had bought a whole bunch of other companies. I think at one point I heard it was 16 or maybe 19 different companies all came together. But because we're PE owned, they didn't really bring everything together, because you never know when you're going to sell off a division or move that one off. So when I walked in, I didn't find an enterprise data analytics team. I found 6 or 7 little data analytics teams all doing their same thing, all with their own data warehouses, all with their own tools, all with their own processes, and they were just happy as a bug, just over here doing their thing. Some of them were waterfall, some of them were agile, some of them were, I don't know what they were doing. But the first thing we did was we focused on, let's bring us together as an enterprise team. Let's do this the Clario way. Let's focus on agile. Let's create Scrum teams that align to the key functions, and then start processing through that way. And I would say that was one of it took a while. It took a while to change the mindsets, but yeah, that was a big one. And you can see some of the things up here that we were tackling coming in. 9 enterprise data warehouses. My favorite is 4 MDMs. Because if you're mastering a thing in 4 different places, what are you mastering? But we had it.
Yeah, that's not a good start. And I can't imagine it was good for your customers either. What were the issues?
No, it was, like I said, because we were so many different companies, most of the products that we push out, or platforms we push out, were developed by different companies, and then they became one. And so if you were doing a cardiac safety and an imaging trial, because those could be the same trial, and you wanted to get some reports, you were getting it in 2 different formats, 2 different ways. I called them the old green bar paper tabular reports, where just tabs and tabs, and they're ugly, and here you go. And so what we did, one of the biggest achievements we've done for our customers is we have all that data. We've got it in a central location in nice little S3 buckets. And we created this thing called Data Exchange, or Clario Trial Picker. Our customers can go in and say, I'm customer A, I've got 8 trials going with you across all your different lines of business, and I want these 4 to dump out to Snowflake. I want this one to dump out to my data warehouse via this API. And they can choose the trials, choose the data they want to see, and dump it out. Huge benefits for them.
Yeah, peak efficiency gain. And in terms of like approaching this very messy architecture, how did you focus? What were your key focus areas?
We aligned to pillars, and that's what we call them. It's like we have these pillars of focus, and some can change, some will stick around for a while, but there's the product kind of customer side, and then there's the internal, what do we do in the foundational side. Governance, huge. Nobody believed in governance until Gen AI came along and they couldn't build their model, and then all of a sudden they wanted clean data. So big push for us. Burn down, like I said, 9 enterprise data warehouses, multiple analytics tools, multiple processes. That's not just burning down the actual physical software, but the processes and aligning to a single way of doing it across all these different lines of business. Our analytics are all over the place. I call it FYI analytics. We want to get to FYA, for your action, not for your information. So that's been a big push, and that's also burning down some of those multiple tools and getting down to efficiencies. On the customer side, it's really been about getting those platforms out there. That's a lot where the FYA comes along. Instead of this ugly tabular report, how about a nice analytical dashboard that points you into something that you need to go worry about? You know, we can still dump the data out there to you, but you know, that's not as critical as the...
Yeah. And trying to do this major transformation, how did you align with your business stakeholders? How did you get executive support?
The number one thing that I preach to my teams, and at least there's one here that she's heard this over and over, consultative approach. Be a consultant, not an order taker. And so we tackle this in several different ways. One of them is the ambassador program. So we've got people on our team, they're part of data analytics, and they sit with finance during their strategy meetings or with sales during some of their meetings, and they just listen. And they get ideas and like, I think I can help solve that for you. Wait, I have a dashboard for that. You don't have to go build something, I've got that. And the same thing with the products, because they're different lines of business, you're sitting at 4 different LOBs. And you hear one say, we really need to develop this, and you're like, wait, I just heard that over here. So then we can come back and be true consultants to our internal customers because of that ambassador program. Another one that everybody always kind of giggles at, I call it a friend in marketing. There's nothing sexy about MDM. There's nothing sexy about data governance, but you get a marketing guy to go over your PowerPoint and clean it up, man, it looks great. So always have a friend in marketing. Keep that guy handy, or girl. Just make sure that they're there. I use that a lot. Another one is the, hey, look what we did. That's what I call the DNA win announcements. We have a regular Connect newsletter that goes out across Clario, and getting those wins into that newsletter and celebrating what we did, it generates people going, wait, you guys can do that? And once again, that's marketing, help me write that so it looks exciting, you know, instead of, we mastered, you know, customer data. They're like, what's that mean? But the marketing guy can make it look great. And then finally, because we were a product of our own success and we started doing things well and celebrating those wins, we had to develop an intake process. We have the capacity to deliver maybe 40 of the 50 things that we get, you know, every. So we designed this process, and it said, you know, what's the ROI? What's the strategic value? What's the impact on a customer, whether internal or external? And it helps us prioritize and align. You know, basically we have the rule, you never say no, you say yes, but. And that yes, but could be yes, but next year. But that's really, when I think of the consultative approach, those are the pillars that we align to.
Yeah. So you moved to a much more simpler architecture. So can we take a look and you walk us through how it is now?
Yeah. We call, what you see on the screen, we call it ELF, Enterprise Lakehouse Foundation. And this is the 100,000 foot view. I mean, I'm obviously not getting way down to the details. But as you can see, on the left side, all the different ways that data comes in. It comes down at the lake level. We've got some Amazon S3 buckets down there. And then we orchestrate it, we clean it up, we do our ETL, and we put that up at the lakehouse level. We enable self-service that way. If, we've got a lot of Power BI developers across the company, and they know how to do it. They're citizen developers. Well, here's your data set. You have access to it, go do it. Our AI/ML, they work in both levels, but they're generating off of this. And then our applications, we do integrations with this. It's really started changing things and letting us get rid of a lot of those old architectures that were just wearing us down.
Yeah, I think when we were talking, you mentioned that reusable data assets that you were able to build, and then you put them in a catalog, right?
Right. Yeah, one of those things when you start getting MDM and everybody starts realizing, oh, we are talking about the same, customer, and then they're like, wait, who else has this customer? What data's out there? How do I find out what's there? And so then you have to start building up the data catalog. That's been one of our big pushes this year, is getting that cleaned up and easy for people to say what's here and what data sets it in and how do I access it.
And so you have multiple data governance solutions, and you mentioned MDM and data catalog. How did you decide where to start, and where did you start exactly?
Well, where do we started a lot of places. We started with MDM because everybody wanted to know that one question. Is this customer the same as that one, or are they in the same hierarchy? Or is my study, I have this study ID, but I can't find anywhere else. Does anybody else have this in their system? And so that's where it started. Really started focusing on getting MDM in place. But then, like I said, once people started realizing, then they started asking for, wait, what other data do you have? What data's out there? How do I get to it? So that's where data catalog is becoming very important.
And so can we look at how you're using Reltio exactly and why you chose Reltio?
Well, during a burn down, we use the term all the time, best of breed. We got to go with the best of breed, stick with the best of breed. Really make sure that we're getting someone who's aligned for our strategic direction. And when talking with Reltio, they nailed it. There was the functionality they had, the price, and the strategic direction that we wanted to go is where they wanted to go. So it has become our go-to MDM. We're down to 2 now, although I think the more we dig into one of those legacy MDMs that was custom built, I wouldn't call it an MDM, but that's what they called it. So we're getting rid of those. And then we're going through and we're mastering. And right now we have customer mastered. We're able to have that be, don't add, look up. Oh, we've got some new information for you. This company moved, or here's some additional enrichment that we can give you. And now we're working on study. And study would be, it's also called protocol. It's like the number that's assigned by the government to any pharmaceutical trial is a protocol number. And sometimes in our company that's called study, sometimes it's called project, sometimes it's called protocol, sometimes it's called, it's all over the place. And so we're tackling study now to make sure that all these different systems, because our ERPs have to charge to the study. Our systems have to know I'm working on this study. And then sites. So for each clinical trial, you could have 500 to 500 sites. If you think that where you go to the doctor and you get the shot, or you go take the pill and they take your blood pressure, those are sites. And a clinical trial on one site doesn't give you enough data. So the best ones are global, all different ethnicities, all different. So we've got to track those. And the funny thing about that is, you're with one company, you call it Walnut Hill. Another company, same site, but they call it 1238. You're like, okay, but it's got a common address, but it's called something totally different. So we've got to be able to align to that, align them to the study, align them to the customer. So those are where we're starting, and then we've already had the request this year, site users, the people there at the doctor's office. That's next for us, because they could work at multiple sites, and we got to know all the sites they're at, where they're logging in, and how to get in hold of them. So
yeah, it's very overlapping thing.
Very
we need
overlapping.
to figure out. And we know that technology is one part of the issue, but you also need to put some new processes in place, especially to not undo the good things that you did. So tell me about the new processes you introduced.
Yeah, I kind of touched on it a little bit, and we're there with customer now. Stop going in and just adding. We're forcing the search before add, where we've hijacked, especially in Salesforce, where most of our companies, customers come in. We've hijacked that add button, and when you start filling it in, it searches first in Salesforce, and if it finds a record, it says, here it is, here's your matching record, go use this. If it doesn't find it there, then we look at the Reltio MDM data set of our gold records and say, here it is in Reltio, and if they click that, then we push it down via the API, it's populated, and they've got this record they can play with. And what that's done is it's stopped the bleeding. Now we can go be cleaning up because we've stopped adding all these bad records. Oh, I forgot to say, if it's not an MDM, then it can go to a data steward. And the data steward can look at it and say, yes, this is actually a new record. I need to put that in, get it in MDM, and let everybody else see it now. So that was key. And now that we've got these golden records, we can push them back down to all the subscribing systems. So your ERPs, your customer care centers, your customer care ticketing system, Salesforce, we can say, here's the gold data. Here's the exact name, address line 1, city, state, zip, country, here it is. And by the way, when we push it to you, you're gonna lock that down. Because if somebody goes in and says, you know, Reltio, and they go, well, yeah, but I want it to show up on my list, I'm gonna take it to Chad's Reltio. You no longer have a golden record. So we've gotta lock down that data if we're pushing you golden data. If you need it changed, we have data stewards, we have a request process, you can do it that way. And that's gonna be true for study, that's gonna be true for site, for everything. We're gonna implement these same patterns to avoid the bad data proliferating.
That's awesome. And so with all these investments, I'm sure some wins already happened. Can we talk about the achievements so far?
Yeah, one of my favorites is, I've said we were a company of companies. I think I showed that we had 9 ERPs at one time. We have got down in the last 2 years to 3, but they're 3 really big ones. And it was taking 6 weeks after month-end close for them to show revenue by customer. And our CFO was just losing his mind. He's like, I want to know what happened, 3 weeks ago, not 6 weeks from now. And they were having to match things manually. Well, we got MDM involved, started getting a good, solid hierarchy in there, and put together a dashboard of the data from these 3 ERPs, and now it's instantaneous. You can go out there and you can say, what was our customer revenue last month? What was it last quarter? What was it 2 years ago? What was it at this week? And so huge gains there from 6 weeks to seconds.
Your CFO must be very happy now.
Oh yeah, they're much happier about that. The big wins is, I've been talking about burn down, getting rid of some of these software packages, getting rid of, or enhancing our processes. We've shown a 4.5 million year-on-year savings already. And we should hit another 7-figure milestone next year and a 7-figure milestone the year after that. And the only thing holding us up is some of the software is on a 3 or 5 year renewal. So we have to wait for it to expire before we really see the savings.
Yeah, and those savings will go to innovation, right?
Right, it goes to more innovation, which then benefits our customers. Speaking of, one of the things we've done, and I mentioned ECOA, we have 15, 16 years of ECOA studies. This old data sitting out there, but it was always in a place where people couldn't get to it. So we brought that together and gave it to our data scientists. And they're able to go out there and mine it, and they're not just looking for what's going on with this study, but what else can I learn from patterns I find in all of this data. And they're able to put out white papers, they're able to really add value to our customers by saying, hey, look, we identified this is something important for you. So it's been a huge value add, just getting that data together. And
and when you give that value to your customers, it goes to patients, the community.
Right.
So it's really getting the most out of the data. I love it.
Yep.
We talked about the cost savings, and what else happening on the analytics side?
I would say the biggest thing that we are really doing, if touched on, is we're really focusing on analytics and trying to get away from reporting. The dump of data is just, it's not beneficial. We had some tabular reports that over 300,000 rows long. Who's going to look past the first 50 rows? Nobody. So, we want to shift that and say, we'll dump that out to you, but here's the analytics that tell you compliance. Here's the analytics that tell you how's that site doing. It's in the middle of a trial. You've got this one site. We're going to flag red for you because their blood pressure always seems a little bit off, or they're always late getting their stuff turned in. And so you need to go address that. And so those are the type of analytics and compliance things that we're focusing on now. And we're seeing big benefits from that with our customers. They're really appreciating that because we're doing what they were having to do.
Mm-hmm. And you talked about the data scientists having access to this now, trusted data. Can you give us more examples of what is possible from an AI perspective?
Yeah, well, we are very big in AI, especially AI/ML. Gen AI is a little bit fuzzier when you're in the medical field because it's not as precise, but our AI/ML models, we can average up to 99% accuracy. And we are able to do things like, one of my favorite ones is readers. Our most expensive things are the doctors that have to read these x-rays, have to read the spirometer data, have to read the EKGs. And we can bring it in, we can auto-label like a chest x-ray, and instead of doing 2 of those an hour for this very expensive resource, they're just the human in the loop now. Now we've trained the model, it's come in, they can look at it and say, yep, that you got it right. And now they're getting 12 to 14 an hour instead of 2. So you can imagine what a doctor charges us per hour. That's huge. Another one was when it's fairly recent. We trained a model of reading spirometer data, but we didn't focus on just a trial. We said, look for all diseases that you can identify from spirometer data. And so we started identifying this very rare disease just by looking at it, and with 92% accuracy. It was like, hey, we're flagging this. This looks like something that it's not part of your trial testing for. You need to tell your patient. And we gave some of those same spirometer readings to humans, said, here, what do you think? They were 38% accurate.
Amazing.
So saving lives, or at least identifying and saying, hey, go get taken care of. 92% accuracy.
This is a great example of what Zach was talking this morning, right? The way that AI can improve our well-being. This is amazing. And so you went through many M&A related aftermath challenges. What would be your advice to those data leaders that are going into an M&A situation?
It seems like we're always doing some sort of acquisition. So I would say, number one, build a playbook. Make sure you have a good, repeatable playbook, and it's going to change over time. You're going to think of more ideas but what questions do you need to ask? Where do you need to focus your time? What are the worries that you need to identify? Focus on process. Process first, because if you're not focusing on process, you may be bringing in another process to someone else, a process you have. Now you've got duplicate processes. Huge problem at Clario when we walked in. Everybody was doing it their own way. So in Salesforce, we actually had splits in the opportunity depending on what LOB, because they had different processes for pricing and proposals, for change orders. So focus on process, but don't be afraid to say the acquiring company may have a better process than you. Theirs might be better. Maybe you need to adopt what they're doing. Don't be so, I'm losing my word right now, but be open to other people's ideas. Determine the appetite for full integration. Like I said, being owned by a PE company, sometimes they were buying companies and they're like, well, we don't want to integrate them because we may want to sell off that division if they're not a good mix. Now they've decided everybody's a good mix and we've got the good mix, so they're not doing that anymore. But that's what led to all the multiple ERPs. If you're going to have a new ERP, if you're going to have a new system, a new CRM, you've got to have a good solid MDM to tie all that data together. And that's how we use ours a lot. And then the final thing, be part of the acquisition team. Enforce yourself in there. Ask those questions. Are we doing an acquisition? I heard there's a rumor. You weren't supposed to hear the rumor. I don't care. I heard there's a rumor. I want to be on the team. Get me into the data site. Get me in there. I want to be part of this because I want to affect the TSA. Right. It's like, we're looking at a 6-month TSA. Well, it's going to be 9 months for us to get done what you want us to get done, so you need to change that. And if you're not part of the acquisition team, you end up getting handed something and told, go do it. And by the way, you have to have it done by this time, and you're like deer in the headlights. Like, how am I going to do that?
Wonderful. Thank you so much for these insights. I have one more question, but I do want to check whether the audience has any questions for you. If anybody, guys see in the back there? Maybe.
Hey, Chad. Over here.
Yep.
Oh, okay. Then we go to the back.
You're CSM, but I do have a question. So on a previous slide, you talked about a reduction in cost, $4.5 million on the tech stack. Can you get a little bit more detail on how MDM allowed that reduction to take place? What did it do to fuel that reduction?
How did MDM fuel the reduction? I think the reduction simplified the MDM process because instead of having 9 ERPs that we're having to pull data from, we have 3. But knowing what was in and where the matches were within those systems, it did help us burn down some of those because it's like, hey, these customers are here, we got the same information, we can pull this in here. But yeah, I would say it simplified MDM. I would just say that a little different.
There was, yeah.
Can you guys hear me?
Yes.
Yeah, so quick question. Earlier in your presentation, you talked about what you walked into. And you talked about waterfall, agile, and you said, okay, we're going agile. I'm familiar with MDM deployments being a waterfall model. Have you done that using agile? And if so, any insights on how you structure the work to be agile?
We're constantly looking for quick iterative wins, and understood that MDM, that's very difficult. But what you can do is some of the steps that I said we implement, like search before add, force down, lock those fields, you can do that iteratively. And it's like, hey, I know that you're not gonna be able to get all this done, but at least put in the search before add. Let's get that in there. We can have a manual process for requesting a new company, but let's get that search before add so we're not adding to the problem. Then we can go and say, okay, now we're gonna add in a request that says, hey, I need to add a new company. You fill it out, it automatically goes to the data steward. Then we can add, hey, we're pushing down golden data to you. Here it is coming via API in a pub sub model. If you take it, go lock down those fields. So it's iterative, it's almost a wagile when it comes with MDM, but it's still better than, we're not gonna do anything until everything's there. We've got this great perfect model. Perfect is the enemy of good. Perfect is the enemy of good. I'll say that over and over. We try to break it out and get those wins, because the quicker the wins, the more people get on your side and start singing the praise and saying, we need to invest more in MDM. Yes, we do, thank you. We need to invest more in data governance. Yes, we do, thank you. But you got to get those wins, get those people on your side.
I see a hand here this way.
Thanks. Yeah, I have a little bit of a question about more of your Salesforce integrations, and you're talking about implementing search before create for your folks to get data into the system. You're mastering it and then locking it down in Salesforce. Am I understanding that correctly? So that people can't go back into Salesforce and change the data that you've already mastered?
Just the parts of it, what we call the minimum acceptable standards, which is company name, address line 1, state, country, and then zip if we have it. Hong Kong won't have that. But we will lock those down simply because, like I said, somebody go in and change some of that. Like, I'm gonna put 2 stars at the beginning so it's at the top of my list every time. Yeah. Well, you just broke, it's not a golden record anymore. So that is one of our data governance policies, that if we're pushing golden data down to you, you're locking down these fields, and then only a data steward in your system has the right to go in and change that.
Okay, so the data that you're considered as mastered is locked down, but you're still allowing sales reps, whoever it is, to go into Salesforce and manage those accounts and do things.
Oh yeah, they can.
It's just not forcing them a new process. Right?
No, it's just those key fields. There's a lot of stuff in Salesforce that we don't have in MDM and we don't want. So let them play with that.
Right. Okay. Technically, how are you integrating with Salesforce? Are you using the Salesforce Direct Connection? Are you using Integration Hub? Do you have an API call? What do you
APIs.
Okay. Yeah. All right. Great. Thanks.
Any other questions? See in the front here. Yeah. Yeah. Okay.
So I have a follow-up question on what he asked. When you are locking the record on Salesforce, are you still allowing the enrichment? Like, if new data coming in, or is it through the data steward program?
It's locked down in the UI, but if we find something, we connect with demand base, and demand base gives us, enrichment like, oh, here's the number of employees, here's the revenue, or let's say a corporate headquarters moves. When we find that, we get that information from the demand base, we publish that out, and all the subscribing systems then have it and update their system. So
Got it.
It's getting out there. It's not locked down to us. It's just locked down from the UI side.
Yeah. Got it. I do have another question about the 6 weeks to instantaneous customer. I can take it offline also, but very interested to know how did you actually achieve that?
Yeah, there's one last question we can take. It was in the front here. Yeah.
Thank you. So I have a question, like you mentioned that you still have 2 MDM. Is there a reason you did not
Well, we found that other legacy MDM wasn't, I mean, it started maybe as an MDM, became part of the transaction, where data flowing into it, they're manipulating it and then pushing it onto the next system. And so now we're working to replace that with a better tooling, but it's still gonna be there for a little while, just priorities.
But you said
basically.
it's not real MDM.
I don't think it's real MDM. When I look at it, they're not really matching and merging. They're just dumping a bunch of data in there and saying, we think these look the same, you know. Oh, but by the way, we're going to change this and this, and we're tracking logistics in there. I was like, it's very confusing on why it was called MDM in the first place.
Just one follow-up question to this. What are the use cases on the clinical side which you are trying to solve or planning to solve using the MDM when you master study inside?
Yeah, well, the main thing, like I said, is we've got multiple platforms, and they all could have the same study, for example. But right now, because we didn't have very good data governance, everybody goes in and keys it in. And the protocol number is 14 digits, I think, Tripti? It's 14 digits long. So imagine how often that gets fat-fingered and wrong.
I see.
And then in the ERPs, they were saying stuff like, well, here's the protocol number. Let me add CS to the end of it because it's cardiac. Let me add EC to the beginning because it's ECOA. And it was just random how they did it. So they're breaking the linkage that we have between them. So we're having to govern that, stop that, look up, don't enter in, and then it aligns and it makes it much easier to report, glean information, know who else is, you know, involved in that same study, what's the revenue per study, et cetera.
So you're planning to do that using search before create kind of a solution?
Oh yeah, with the search for create is going to be with all of our master data.
Thank you so much. Thank you for this very interactive session. We appreciate it. Thank you for being here and sharing your journey. Thanks, everyone.